As we approach a year of COVID-19, isolation is taking a toll on people's mental health. Kayla Green talked to a therapist about what he's been seeing.
A year of Zoom calls, distancing from our closest loved ones, and working from home is wearing on many of us as we long for the day when we won't need a mask to go out in public anymore. Elliott Goodness is a program coordinator at the Genesee Mental Health Center. He says whether you're someone who's been in therapy for years or are just thinking about talking to someone now, it takes courage to take that step.
Redefining and taking a look and finding that meaning, finding some purpose, I think is a really, it's brave work and it's hard to figure out.
Goodness says for many, the answer is telehealth.
Being able to step away or step into the car for a moment, check in with a therapist, it's really, for our field, it's really catapulted us forward as we notice that mental health, stress management.
Common reasons for people's mental instability right now include a lack of routine, increased screen time, and now the dark, cold winter weather on top of it all. These factors are also affecting people's sleep patterns. Alice Hoagland is the director of the Insomnia Clinic at the Unity Sleep Disorder Center.
You begin to lose this real sense of regularity in your life. And from our experience, it seems like this is one of the biggest disruptors for sleep, because sometimes people will sleep in until 8 in the morning, and then other times they will be getting up at 5 in the morning, or they'll go to bed at midnight, or they'll go to bed at 9 at night.
So how do we combat this on a daily basis? Both say focus on the small victories.
Just sort of randomly do something that's novel and different. We find that people's moods improve pretty significantly.
For some folks, it's just knowing, you know what, I cleaned up my apartment, I cleaned up my house, I was able to go for a walk today. You know, things that traditionally we might not give ourselves a pat on the back for. It can be really empowering to say, this is hard. This is a hard time to be me, and I'm doing the best that I can.
Goodness also says checking in on people you haven't heard from in a while is another way to keep yourself healthy. He says even if you're unsure if therapy is for you, what's the harm in giving it a whirl? You might just like it. In Rochester, Kayla Green, News 8.
All right, Kayla, thank you. On that last note, if you do want, Goodness recommends talking with your primary care provider or simply calling 211 to find a therapist that's a good fit for you.